In this workshop, experts from medical universities across the country are participating, and the goal of this two-day workshop is for participants to become familiar with topics related to traffic accidents, drowning, and burn incidents, along with the epidemiology of these accidents and disasters at the national level. They will be able to develop a strategic and operational program in the field of health departments of medical universities and, God willing, implement it.
The Ministry of Health and Medical Education has two serious roles. One role is pre-hospital actions, and it also fully demonstrates its role in the treatment sector within its medical centers. One part of this area that we were serving friends today is mostly focused on behavioral and educational work. This means that with the training they provide, they can make the community aware and informed about many issues. One of those points could be increasing the understanding of risk regarding traffic accidents. Therefore, the Ministry of Health and Medical Education, as one of the very strategic and important ministries, plays a decisive role in reducing the injuries caused by traffic accidents.
This workshop was and is very necessary to discuss policy making and planning regarding incidents, which is one of the main causes of mortality in our country and provinces. In this workshop, more focus is on traffic incidents and other events that lead to human deaths, and it is a valuable effort organized by the esteemed colleagues of the Ministry of Health.
The claim is that the training provided here was very useful, and God willing, we will try to transfer this knowledge in a cascading manner within the department and maintain the same training continuously and have a connection with these friends so that we can take a step towards reducing turnover.
The workshop is excellent because I think it is actually the first training workshop held at the national level for accident prevention. For many years, accident prevention for different age groups in health and treatment networks has been a priority and has been very successful so far.